Making money with Michelle. Making money with Michelle. Making money with Michelle. Making money with Michelle. Hey YouTube, how y'all doing? I am Michelle Morar. And today I am explaining Medicare and Social Security benefits for those turning 65. Hopefully to help them avoid penalties. I'm going to point out where there could be a possibility of penalties and how to avoid it. Okay, let's get started here. When you're turning 65, you will get one of these books, Medicare and You 2021, put out by CMS. That's the federal government, the Centers for Medicare and Medicaid Services. And once you sign up for Medicare, you will get this handy dandy little booklet sent out to you each and every year with any updates. They will have it in this booklet. There's a lot of information in here, but I'm going to give you a little bit of a shortcut, okay? So that you can have some of the basic understanding of what is in this booklet. So let's get started. First of all, I would say that Social Security and Medicare go hand in hand, together, like peanut butter and jelly. And I'm going to tell you why, because most of the time when somebody signs up for Medicare, there is a premium under the Part B, and they want to have that paid out of their Social Security, so they'll go ahead and sign up for Social Security. Now, I'm going to let you in on a little secret, okay? Because one of the basic decisions that you need to make is, when are you going to retire? When are you going to access these benefits? You could access Social Security as early as age 62. Unless you're on disability, you cannot access the Medicare benefits until you're 65. So there's a 3-year discrepancy. Now, let me explain something to you. I have seen for the last, probably since 2008 or so, somewhere thereabouts, the big push from the industry was to talk about Social Security and how to take advantage of the best strategies to get the most money from your Social Security. They all ended with this: you could, without any strategery at all, and I just made that word up, strategery, any strategizing at all, if you just wait until 70, you are going to get the biggest, best bang for your buck. You're going to get the most from Social Security that you could possibly get. But the problem is if you waited until 70, then you would have to pay that Part B premium for Medicare out of your own pocket. That's interesting, isn't it? Who's behind these benefits? The federal government. The federal government. So they have an incentive for you to wait as long as possible to go on these benefits. But let's take a look at Social Security. The full retirement age for somebody who is turning 65 this year, that means they were born in 1956. The full retirement age for someone born in 1956 is 66 years old and 4 months. That means for Social Security, you will not be getting your full retirement age benefits if you go ahead and sign up for Medicare at age 65 and you sign up for Social Security at age 65. But the whole point is, I'm getting tangled up and I can't move. The whole point is for them to say, okay, you can go ahead and sign up for Medicare at 65 and you can wait to get your full retirement age benefits from Social Security. But it's a way to control you, to have you get your benefits at a later time with either Medicare or Social Security or both. just a little inside baseball stuff for you to share with you, because I don't think a lot of people put two and two together. If you're born in 1957, it's 66 and 6 months. That's when they will let you have your full retirement age benefits. Now, just like if you access Social Security at 62, it is based on the age that you are when you start Social Security. That's what your benefits will be. But I'm just talking about you're not going to get your full retirement age benefits. You have to postpone that. Okay, I hope you see that, and I hope that is clear. I'm not saying that you can't access your Social Security, because you can. You can start it as early as 62 years old. But they have an incentive. They say, okay, if you want Medicare and you want the ease of doing business with the government, we will let you start your Social Security at age 65. Now, yes, you're not going to get your full retirement age benefits, but you're still going to get a Social Security check. Woohoo! Happy days! I just wanted to share that with you. Hopefully something will start to make you think about some things a little bit. Both of these programs have problems, and they're trying to push those benefits way on out there. But what the government gives, the government can take away. Hello. Now let's talk about original Medicare for a moment. It has an original Medicare. It was started by Lyndon Johnson. He wanted to secure the vote for the Democrats for the rest of their life. We're going to take care of you in your old age. So original Medicare was started, and we started paying taxes into the system, and it has two parts in original Medicare. Part A, it has the hospital and the skilled nursing. Typically speaking, there is no monthly cost. There could be, but most people will not incur that cost, because it's a matter of you paying into the system a long enough period throughout your work lifetime, and most people have enough lifetime work credits. Part B has doctor and outpatient benefits, and that is $148.50 monthly. And that's what has to be paid for you to start on Medicare. It could be more than that, and then that is determined by IRMA. If you are a high income earner, then IRMAA, you could be forced to pay a lot more than $148.50. With original Medicare, if you do not do it the correct way, you could have a late sign up and it would affect you. You would pay a lifetime penalty that is with you for the rest of your life. Okay? That's why you need a professional like myself. So if you're getting close to the age of 65, you need to talk to someone like myself. You can talk to me at www.michellemorar.com. You can go to my website, request information, ask me questions, and I can help you through the process. But you really do need to talk to an expert, because there are penalties, there are minefields that could cost you for the rest of your life. I want to make that clear. And that pertains to the Medicare Advantage plan as well. So it's not just original Medicare. It can affect your Medicare Advantage, because if you don't sign up for the Medicare Advantage, well, you can't sign up for Medicare Advantage until you sign up for the Part B. And the Part B is where you're going to have lifetime penalties if you do not do it the right way. So it affects your Medicare Advantage. Now, Medicare Advantage is considered Part C. That was originated in 2005, and it has all the same benefits as Medicare, but you have copays and deductibles. Well, you have copays and deductibles with Medicare, but these are, and with the Medicare Advantage, you also have a maximum out-of-pocket expense. You have a cap. Unlike original Medicare, which does not have a cap, Medicare Advantage does have a cap on the maximum that you would pay in a year's time. Medicare Advantage is administered by private health insurance companies. They take the same dollars that are afforded for original Medicare and they administer it through a Medicare Advantage. Now, some of the differences, they have copays, deductibles. There is no additional cost on a lot of things. You're still going to have to pay that $148.50. Some people say zero cost, but that's not true. It is a cost. There is no additional cost or low premium. Some areas have a little bit of a premium associated with the Medicare Advantage plans. Now, the other thing is there are networks for doctors and hospitals associated with the Medicare Advantage plans. That's where you need an expert like myself to go through to see if it is an appropriate situation for you. Everybody is different. Not everybody should have the same plans. Okay, everybody is different. But the Part C is a way that you can take advantage and include prescription drug plan in the plan with no additional premium. And sometimes, I will tell you this, sometimes some companies will also give you a rebate. So they'll give you a little bit of money back so it won't cost you as much. But there's still a cost. Okay, there's still a cost. So that's why you need someone like myself. I can share with you the plans that have all of these different types of benefits. The Medicare Advantage plans also have gym memberships. They also have meals delivered after you're in the hospital. They have transportation benefits. There are all types of benefits that you can access with the Medicare Advantage. But there is a cost. You have to stay in their network, in their doctor network and the hospital network that they tell you to go to, because they have arranged special prices for people, and that's how they're able to give you more benefits. Okay, I think I have covered that pretty clearly. You have Part A, Part B, or Part C. Now, let's get to Part D, which is the drugs. There's a drug plan included most of the time in Medicare Advantages. But when you have signed up for Medicare and you do not sign up for a Part D, you could be penalized for your lifetime because you did a late sign up and you did not do it the proper way. There are instances where you can postpone that, but those requirements need a professional like myself to guide you through it. So if you're getting close to 65, you need to contact me or someone like me. I am just telling you for your own benefit so that you will not incur those penalties. Now, this is a separate penalty from original Medicare. So you could be having an original Medicare penalty and a Part D penalty. So that's why you need to talk to someone like myself. You can talk to me at www.michellemorar.com. I will leave that link in the description below. Now, if you decided to stay with original Medicare and you picked up your Part D and you didn't have any of your penalties, you may still want to get a Medicare supplement or Medigap insurance. And the reason is why? Because unlike the Medicare Advantage that caps out the maximum that you could spend in a year's time, Medicare has no limits, and you have a 20% co-insurance that you could be responsible for. So if you had a $100,000 bill, you could be responsible for a $20,000 bill. If you had a $10,000 bill, you could be responsible for $2,000. It could be way less expensive to get the Medicare supplement as opposed to paying that if something happened to you. With the Medicare supplements, there is an open enrollment. When you are turning 65, there is an open enrollment. You have special privileges. The open enrollment, which means that the 3 months before you are turning 65, the month of your 65th birthday, and 3 months after your 65th birthday, You do not have any, they can't, the insurance company can't turn you down. They have to accept you. That means if you have health problems, they still must accept you. They still must accept you. So that's why it's important that you speak to someone like myself around that time period so that you can be set and not incur any of these penalties and get all the benefits that are afforded to you at age 65. There are 10 plans. G has the most benefits, but all 10 plans are all standardized. The government has standardized, and what that means is there's very little variation between the different plans. The biggest issue is the price. So I'm going to give you, and there are benefits and there are discounts that are available to people with Medicare supplements. That's why you need to talk to someone like myself. I am an independent agent. I'm not locked into just one company. And I can talk to you whether you're in North Carolina or you're in Hawaii. I can talk to you. Licensed in all the different states. Anyhow, this is a male 65 who is single. That means he's going to have to pay the most. And it's a Plan G, the best plan, and he is non-tobacco. And he's turning 65. I'm going to let you see those rates. I've got 3 different states. I've got 3 different companies. And I just picked those companies simply because they are well known. You've got the AARP, Humana, and Mutual of Omaha. I've got North Carolina, Florida, and New York. Now, North Carolina, with AARP, you could get a Plan G for $118.79. If you go to Miami, Florida, with AARP, you could pay $253.20. If you're in Jacksonville, Florida, on the other hand, you would only pay $178.25. It's the same plan, the same person, different locations in the same state. If you're in New York City, New York, you would pay $270 with AARP. In Buffalo, New York, you would pay $215.25. So it depends on your location, okay? Humana, North Carolina, it's $135.36. Miami, Florida, it's $276.90. In Jacksonville, it's $193.42. In New York City, New York, it's $398.30. And Buffalo, it's $271.20. Mutual of Omaha in North Carolina is $129.52. In Miami, Florida, it's $287.58. In Jacksonville, Florida, it's $191.10. In New York City, it's $476.04. And in Buffalo, New York, it's $377.55. Whoa, that was a lot. You can tell by the location of where you're at, you can have the same exact plan, the same exact company, and have different rates in the same state. Now, North Carolina is a little bit different. Well, there's a lot of states like North Carolina, but there's a lot of states like Florida and New York. It depends. So you need to be aware of your situation. That's where an expert like myself can help you. And if you would like some assistance, go to my website, www.michellemorar.com. Now, with that being said, with Original Medicare, you have a cost. With the Part D, you have a cost. I didn't say that, but it starts out as low as $10 a month. $10 a month, you can get a plan. The Medicare supplement has a cost. You can also purchase a standalone dental and vision plan. Those are cost. Now, with all of these costs, it is important to talk to an independent agent. That way we can help you to find the best deal for your situation and give you the ins and the outs, the pros, the cons. You may want to get a Medicare Advantage, and there may be no additional cost, but you're not going to be able to get a Medicare supplement, and you're not going to get an additional plan of standalone dental and vision because it's included in the Medicare Advantage. These things, the supplement, the dental and vision, and the drug plan go with original Medicare. So there's a lot of things that you have to decide. So that is where you need someone like myself to help you. And I am available, licensed in all the states, and I can help you. Can help you right over the phone. We can have a Zoom call. We can do all kinds of things. I can help you, and I'm more than willing to do so. But you got to reach out to me at www.michellemorar.com. I will leave that link in the description below. While you're at it, if you enjoyed this information, if you learned something, comment below and tell me that you learned something. Smash the like button, and for nothing else other than payment for all the information that you have gained, hit that subscribe button, because that will allow YouTube to know that I have been effective, that the information that I have been giving is very good, and you can subscribe to this channel and get information like this all the time. Thank you for your time, and I will see you again another day.